Hey guys, it's a great day to be healthier and happier without knee pain. I'm Dr. Emmett Blahnik here at the Knee Spa Service Center in Clearwater, Florida, Tampa, Oldsmar, St. Pete. We're off of I-19 next to the Fresh Market. Jason's Deli's kitty corner to us. But what we're going to do is we're going to show you how we help people with knees that's non-drug, non-narcotic, non-invasive, non-surgical approach to rapid, reliable knee pain relief. One thing that we use, the technologies are very cutting edge. It's things people are searching for and looking for. We're going to demonstrate and give you some examples of what that looks like today. But in particular, the knee decompression device, Knee Spa DRX4. Why don't you come with me? But this is our Knee Spa DRX4, decompression, tractioning, vibration, infrared light therapy. We're going to be introducing you to EMTT, which stands for electromagnetic transduction therapy, and how that in conjunction with knee decompression as well as shockwave, infrared light therapy, some of the unique protocols we use to really rehab those knees, even some of the worst, where somebody's like, I've tried everything, it's bone on bone, all I'm getting is the cortisone shots. You haven't tried this? And if you haven't, I would encourage you to come in, make an appointment, and let's kick the tires and see if it's gonna help you. So you can just imagine if somebody had like bone on bone. Every time they take a step, it hurts. So this is essentially getting that sponge decompressed. We're not trying to pull off the leg. It's just that movement, pumping the sponge, getting more nutrient exchange into that tissue. Most knees are a tissue issue first that become a bone issue. But anybody with a osteoarthritis of the knee, this home knee decompression would just feel amazing. So this takes a bit of a setup. All right. What I'm going to do is I'm going to pump this up, make it as tight as I possibly can. Okay. Until you say stop. We need it as firm as possible. So until you just say stop. It should be a minute.
Okay, stop. Yeah.
That's not even tight.
A little tight. Okay,
there you go.
That's good.
All right. So you have different settings, different pounds of pressure that we can pull it to. Deviation from side to side, right and left, up and down. What we're going to do is just start with something real simple so you can just see the movement, but not necessarily treating you. Okay. I got to get this guy plugged in here. So as you notice, it's moving out. So when this is secured and this is secured, it's going to give that decompression. And then it's going to start to pulse as well. But we can also open this up one side or this side. So if this side was collapsed, we could open it up and angle it that way. If you want, get in there close so you can see that pulsing. That's one of the main features, and it's a significant feature. This is doing a pumping action, a pulsing action. And we add vibration therapy.
It's interesting.
So if you pictured somebody with a bone-on-bone knee,
yeah,
and then you could do 60, 80 pounds of pressure. I'm going to stop the vibration. And now, while you're doing that, we're going to set up the EMTT, electromagnetic transduction therapy. Many people are familiar with the popular technology called PEMF, pulse electromagnetic frequency. This is essentially a focused version of that, concentrating on the knees. And essentially what it does is it charges the cell walls. And when that happens, it opens up the sodium-potassium pump exchange. And for us, for a client or a patient, it would be really about nutrient exchange. We're trying to get nutrients into the cartilage, into that tissue. And we can use a process called imbibition. And this charges the cell. It has inflammation modulation, so it'll help reduce inflammation. And it actually stimulates the electrical circuitry of the nervous system as well. So a lot of things involved. I'm going to turn it on, give you just an idea of what it feels like and looks like. So in an integrative approach, we have 6 essentials, 6 integrative essentials for rapid, reliable knee pain relief. The integrative side of it is we're using various forms of technology: vibration, decompression, EMTT, shockwave. So that's the integrative approach. We're going to use supplementation and lifestyle. The essentials are, if we're missing certain components, we just know that it'll take somebody longer to heal, repair, regenerate. If we are using the essentials, then people get where they want to be very quickly. They get the results. Even people that have been told there's nothing else we can do except for surgery, it's bone on bone, we actually stop the progression, in many cases reverse it. So most people, if they're a qualified candidate, we would do an integrative approach, not just one injection or shot like cortisone and hoping things get better. So EMTT. So if you feel like you've tried everything, chances are you haven't, and this is one of those things where we're going to start to integrate now some rehabilitation. Start this very low. So you really feel that?
Yeah, I feel it a little bit.
What does it feel like? Like a pulsing?
Yeah, it feels like a...
I'm going to turn it up just so you can...
Yeah, I feel it now.
Great.
Electric power.
Electrical magnetic. That's exactly what it is. Stimulating an electrical conductivity. Now, if your pants, if we had you in shorts here, what we'd also do is then add another level of cold laser therapy. Class 4 cold laser. So right now we have multiple technologies happening at the same time, facilitating a process called imbibition. And imbibition is really allowing the nutrient exchange into the tissues. I think it's a missing link in working on it because it's so simple to do. But when we look at this, we got decompression, we got the pulsing or the pumping. I'll show you an example of that with a sponge shortly. We have EMTT, and now we also have cold laser. So multiple technologies with vibration therapy. So this is really important for people that have kind of used their last resorts, multiple rounds of cortisone shots, painkillers, and they feel like there's nothing more they can do. So this is a better option.
Everything feels great.
Does it?
Yeah.
Yeah. It can go really intense. We're going to stop the cold laser. We're going to stop the EMTT. And then we're going to stop vibration, and then decompression. That's knee spa decompression. We'll talk about shockwave here in a moment. Maybe this can help us. So a lot of times people come in with just really bad cartilaginous tissue. The meniscus is breaking down. Kind of think of it like a piece of beef jerky versus something that's normal like a fillet. And so there's a lot of dehydration. You can kind of think of it like that. I think of it more like a sponge, a dried, withered up sponge. And somebody is in gravity, their torso weight is compressing that sponge, and they've actually shown that if you lose a pound off your waist or your body, it's like taking 4 pounds of pressure off of the knee. And so when somebody's really facing these osteoarthritis of the knee, degenerative joint disease, it's breaking down, what happens is we essentially take this dried, withered up sponge, which would represent that tissue, kind of think of it like a deflated tire. And we've always been told, like, if you get a flat tire, what should you never do? You shouldn't ride the rims. So what happens is it becomes a tissue issue. It's a tissue issue first, and then that becomes a structural component where the bones get deformed. So the tire goes flat, you ride the rims, and then you ruin the rims. So with this, we want to rehabilitate the tissue. So the 6 essentials is about a tissue issue as well as correction and alignment. So if this is a dried, withered up sponge, and then I'm just pressing on it. What we want to do is we want it to absorb the nutrients to rehabilitate that damaged tissue. So if I pour the water in this, but I just keep pressing on it, that's you sitting on the couch, that's you just walking around, there's no movement. And out of gravity, if I start to pump this like this, is effectively what we're doing with that pulsating effect with decompression is we're simply pulsing this, and what it's doing is it's soaking up the nutrients. So whether somebody's like spent a lot of money on like stem cells or PRP and you feel like, hey, it didn't get you where you want to be, you might have had that missing component of what's referred to as imbibition. Imbibition is where your body's biological processes getting the nutrients into those hard tissues that need to soak them up, essentially taking the beef jerky into the filet mignon or pumping up the tire, so to speak. And so this process of imbibition is the pumping while under decompression. So shockwave therapy, what's interesting is they actually use it in like hospitals and clinics for lithotripsy. Would break up kidney stones. They can do some things with gallstones, and then it got adopted orthopedically as stimulates the central nervous system to know that there's a tissue issue or tissue injury. It stimulates your body's own production of stem cells and aggregates them to the areas of tissue injury. It has a pain modulator. It has an inflammation modulator, so it brings down inflammation quickly. People tend to feel it or notice it quite quickly within a day or two. So there's a pain modulation, inflammation modulation, which is really critical for anybody that has osteoarthritis or arthritis, because that's a chronic inflammatory condition, and we can immediately start to intervene in that, not just to make you feel good quickly, but also to repair, regenerate, and heal that tissue, your body's ability to repair, regenerate, and heal. And in the 6 essentials, the essential side of it is stimulating your central nervous system to know that you're still injured. So when you have a chronic condition, what happens is chronicity means time. A chronic condition means it's just been happening for a long time. And what your nervous system tends to do is it tends to say, hey, Bill, you've been dealing with this a long time. In fact, you even took the cortisone shots, you took the pain pills, the opioids, and you're essentially telling your brain to shut down the repair of healing. Repair, regeneration, healing, aggregating those stem cells that would normally aggregate because it's going on for so long. It's essentially your body saying, hey, Billy, you're just adapting to your life to this, so we no longer have to repair this, particularly if you're doing those types of medication. Shockwave therapy will actually help jumpstart and stimulate that healing process again. The shockwave therapy doesn't heal, it stimulates your body to produce the cells, but also aggregate the cells to the tissues to actually start that process again, jumpstart the healing process. So you never stopped healing. God created your body amazing to repair, regenerate, and heal. Never stopped. You always have that ability. This is going to jumpstart that process again. So with shockwave therapy, one of the things it does, we have a lot of tissue issues. So you think of these ligaments, tendons, cartilage, a lot of tissue in here, and I want you to think of these tendons, whether they're here or wrapped around your knee. The tendon that attaches to your patella, that little bony structure here, think of those like a pliable Twizzler. You know, it needs to be nice and soft. I can bend it, which means at 50 years old, I should be able to bend down like this without too much discomfort and pain. I always picture when I ask somebody really struggling with knee pain, whether they're in their 40s, 50s, or 60s, would you be able to spread your legs, sit your bum out like you're sitting on a chair, and squat down? And a lot of people would be like, no way, that would hurt too bad, or that would be too difficult. And the reality is it's true, because what's happening is if you have severe osteoarthritis, there's calcium ions or calcium oxalates that are depositing into these tissues and essentially making them more crispy, more rigid, more propensity to tear things. So where I would squat down in my 50s, that actually may have somebody tear something at some point, you know, but that's not the way it should go because of your age. So what we're going to do with shockwave is, that's been shown to like break up kidney stones, lithotripsy. It's going to break up calcification deposits, scar tissue. It allows for more pliability, more viscosity so that you can have more range of motion, more mobility, which is really equals to you more quality and freedom of life. And so, but most people just love it because it makes them feel good pretty quickly. And so when you're dealing with your own body's repair mechanism, sometimes that takes a little longer, but sometimes it's worth it. So we're taking things that get crispy and brittle, like a Cheeto. Your tendons are turning into Cheetos. Crispy and brittle, and that's why they're more propensity to crack, break, tear something, when what we want them to do is we want to turn them more into pliability, viscosity, flexibility, and range of motion like a Twizzler. And that's what Shockwave will help us do, but also get you out of pain pretty quickly. Okay, so focused shockwave, there's different types of shockwave. I would encourage you to look up focused shockwave therapy. This is electromagnetic acoustic sound waves that travel through aqua water bladder. That dissipates the discomfort of it. I wouldn't say it's necessarily too comfortable to do, but it's worth it when somebody's walking with more range of motion, more flexibility. So this is a water bladder that I'm gonna pump up a little bit, as you can see here. And this is gonna produce an acoustic sound wave. And what that's gonna do is focus shockwave. What I would again encourage you to do is look into it, more of what it does. It stimulates the production of stem cells from your bone marrow. So you're actually using cells that most people are more familiar with now than ever before, stem cells. It can help identify where the tissues are injured. It'll be more painful. For example, if I can use your arm.
Yeah.
So if I rub my hand on your arm, there's no pain.
Yeah.
But if there was a cut here and I rubbed on it, it would be painful. So where this detects things is where the tissue's injured. It'll be more painful. And that's actually where we want to be despite the discomfort. It's going to stimulate production of cells. It's going to stimulate your brain to say, hey, we are injured here. We need to jumpstart that healing mechanism, healing, repair, regeneration. It has an inflammation modulation, quite quickly reduces inflammation, breaks up those calcification deposits, so we're making the Cheetos into the Twizzler, more pliable, more viscous. And then most significantly, what people really do it for the most often is it's incredible for pain and discomfort.
Okay.
So by the end of the day, somebody's already noticing quite a significant difference, not just in their pain levels, but their mobility levels. Okay.
That's very important.
So let's get started. This is going to give you a little impulse. I'll show you what it sounds like. Why don't you put your finger on there? It's very hard to describe, isn't it?
It is very hard. Just like,
That's it, yeah. So a little gel. We're gonna work right on that IT bend issue, right in here. So you notice that.
I feel that.
So the other thing is tendons attached to the patella. It's very common. I've never seen a phase 1, phase 2, phase 3 bone on bone knee without looking at chondromalacia patella. Chondromalacia patella is essentially degenerative joint disease, including the patella. And then there's bone spurs that come off the patella. And so this helps break up calcification deposits, calcium oxalates, and you can begin to see some of that spurring in the kneecap. It's called enthophytes. You can see those begin to dissipate over time. So again, your body has the ability to repair, regenerate, and heal. This doesn't heal, but it stimulates your body with regenerative medicine.
Right here.
There you go. And this can go up quite intensely if you want to listen to the intensity of it.
Oh, very good.
That's how intense it can go. And that's
In
pretty...
what cases do you go that intense?
When somebody really can tolerate it, so one of the first things we would do with a patient coming in is do a new patient exam, consultation, figure out what's going on with them, if it's a case that we can accept, if they're a candidate for this. And then the first visit, we try to do a tolerance testing. Decompression tolerance, can you tolerate this type of stuff? And if a person can't, then we just know it's not an option for them in their integrative approach. But there's not one thing that we do. It's multiple things. And if you kind of think of like a lot of people are really trying to rehabilitate that damaged tissue, Think of it like baking a cake. In the cake, you got to have the right ingredients: milk, eggs, and flours. If we're missing one of them, then we're not baking the cake. So we have the ingredients that comes in the form of the supplements, the nutrients we would recommend for tissue repair. And then we get into technologies, so the integrative side of things. Baking a cake, besides the ingredients, are you going to bake it in an oven? Are you going to bake it in a microwave or the cookout grill?
The oven.
Obviously the oven. So now we need to know, okay, the right technologies we have in place. What about the right protocols? Well, you got the right ingredients. You're going to use the oven. Are we going to cook it at 100 degrees or 500? Probably somewhere in the middle, right? And so having an understanding of not just the ingredients, but the recipe. Here's how we're going to do this. And we lay that out in our 6 integrative essentials and our core 4. Core 4, rapid, reliable knee pain relief. But baking a cake, you got the right ingredients, you got the right technologies, now you got the right temperature. And so it's just not having these things, it's actually knowing how to use them, not just in the clinic, but for every candidate that we qualify for a knee spa, is we also give them a home care program, whether it's 90, 120-day home knee rehabilitation program, interacting with us every single day.